how you repair some of these hernias. I understand there are different techniques to do it. You have like robotic surgeries.
Correct.
Yeah.
The classic approach was an open approach, and that's how it was done for years. Now it would just be simply making an incision over the hernia, going down, finding the hole, closing it with stitches, and then at some point you decide whether or not to place a mesh. Now things have advanced, and about 20 years ago they began with laparoscopic procedures in the 1990s, and those 3 or 4 small incisions, you enter the abdomen with a camera, and you come in from below, what's called a perineal approach or a posterior approach, and you come from underneath and you repair the hernia from inside. You close the hole very similarly. The principle's the same. You close the hole, and sometimes, once again, you decide whether or not to place a mesh. Now it's gone in the last 5–10 years toward robotic surgery, and in robotic surgery, it's very similar to laparoscopic surgery in that it's the same 3 or 4 incisions, just the technology's advanced. And instead of standing over the patient, we actually stand at a console, typically in the same room, and we control the trocars or the arms of with the robot with the console. And what it just increases dexterity, it's better visualization, it gives you a 3D image. It's just the advancement of technology, and really where all future surgery's probably heading.
Right. Wow. So you said you use cameras. Can you expand a little bit on, like, how do you get a camera in there?
So when you make 3 or 4 little incisions, and one of those incisions, the camera will go through that incision, and you can actually put the camera in whichever incision you like, depending on what you're trying to visualize. And the camera these days are becoming more flexible, higher definition, so it's really increased the visualization, made the surgery safer, decreased complications, and it's more than anything a tool. I tell all my patients, really a surgeon should know how to do the surgery in all 3 ways: open, laparoscopic, robotic, and tailor the approach to the patient, because there is still certain patients who are better with an open approach, without a doubt.
Right.
Some better with a laparoscopic, some better with robotic, but it's just a tool you have, and then when it's the best thing for the patient, that's how you should approach it.